I am Peter Fale. I chair the Friends of Blandford Hospital. It is one of 11 community hospitals in Dorset who are run by the Dorset Healthcare University Foundation Trust. The NHS is divided into providers such as the Dorset Healthcare and the commissioners who will by April become the clinical commissioning group chaired by GPs. They will decide how the money is spent, and the providers will be the ones who spend it. We are fortunate to have 11 community hospitals in Dorset because the aim is to have treatment for people as close to home as possible, in home wherever possible, but community hospitals do offer a much better service close to home for people who need to have a more intensive care, and it will avoid unnecessary admission into the acute hospitals, unless of course their situation requires that. The Friends of the Hospital support both work within that hospital but also work in the much wider community, such as work in leisure centres and various other charities that are health related. We also run a volunteer scheme who are basically providing transport, and we have done so since 1996, and we are averaging over 500 visits a year now, mainly to taking people to acute hospital. We currently have one minibus, but it is hoped that in the new year we will be getting 2 minibuses so that we can increase both the transport to hospital but also run outings for disabled people particularly. We have 2 charity shops. We are present in one of them in Barrack Walk in Blandford. The other one is at Sturminster, and they provide the major part of our funding, and at the moment they do raise over £2,000 a week. They also offer excellent value for anyone who wants to economise on their clothing. They are run by volunteers, so we have 2 types of volunteer. We have the drivers and we have the ones who work in the shop. We also have some involved with work in the hospital, taking around tea, and most importantly, they do have time to chat to patients. The hospital itself has undergone a great deal of transformation. We now only have one inpatient ward, the Tarrant ward. The Portman ward has been empty for the last 2 years, unfortunately, but it is our aim to develop it as a day hospital as opposed to an inpatient facility, and in that regard we are now working very hard to develop services that can happen in the Portman ward, such as blood transfusions, chemotherapy. We hope that the Weldmar Trust will be able to develop it as a day hospice facility.
Hello, Gordon.
And there will be various other services developed there, podiatry, hopefully, pain relief, and in that regard we are anticipating that we will be needing to fund the development of what we would call a high-tech treatment centre to facilitate these services. So we are at the moment feeling very positive about the the development of the hospital and feel that it will become an excellent centre for the 21st century to provide the healthcare that this area needs.